Hello, everyone. Thank you for joining us on the program this evening. We're turning our attention tonight to health and to a disease that is no longer a distant health concern in Nigeria. Cancer is now deeply personal for thousands of families. Every year, more Nigerians are being diagnosed late, paying out of pocket, traveling long distances for care, or even abandoning treatment entirely, not because solutions don't exist, but because access, awareness and equity remain major barriers. Today is World Cancer Day, and the global theme for 2026, United by Unique, could not be more relevant to our reality. It reminds us that while every cancer journey is different, survival should not depend totally on where you live, how much you earn, or how early you were lucky enough to be diagnosed. So every year, millions of people around the world unite to shine a light on one of the most pressing health challenges of our time. And on World Cancer Day 2026, the global community is renewing its call for awareness, early detection, and equal access to quality cancer care. TVC News' Kemi Balogun has more in this report.
Breast cancer remains the most commonly diagnosed cancer worldwide, accounting for more than 2 million new cases each year. While the disease affects women far more frequently, health experts warn that men are also at risk. Male breast cancer accounts for about 1% of all cases and is often detected late due to low awareness. Jacob Omonade is one of the few men diagnosed with breast cancer, a reality many still find difficult to believe.
2024, that was April. I was getting dressed for work in the morning, and while I was getting dressed, my wife noticed that there was a black patch underneath, you know. So she was not like, that's why, that's, as in she was just questioning me, what is that dark, this thing, your body? So I was not like, what? So that was when I checked. And when I checked, I discovered that it was where I had that lump, that, you know, it had increased in size, and it was not having black patches at the surface of it. So that was when I got really, really scared.
According to the International Agency for Research on Cancer, 4 in every 10 cancer cases globally are preventable. The agency estimates that about 37% of new cancer cases recorded worldwide in 2022. Diagnosed at almost 50 years, Jacob tells us it has not been an easy road as he seeks better health systems that will support care for cancer survivors like him.
I want to appeal to the government to please try and set up get more machines, you know, because a whole lot of the problems that we actually face as cancer patients is the fact that the care is very, very poor. You get, and you go to hospitals, you find out that before you see a doctor, it's 1 month, it's 2 weeks.
Some experts believe this year's theme, United by Unique, should be measured by whether prevention reaches those with the least access, with conversations around this issue never been more urgent. Kemi Balogun, TVC News, Abuja.
Joining me on Beyond the Headlines today is Dr. Bukola Oshinkalu, who's a radiation and clinical oncologist at the MedServ Luth Cancer Center, one of Nigeria's foremost cancer treatment facilities. She's a fellow of the West African College of Surgeons and a member of the Association of Radiation and Clinical Oncologists of Nigeria, with years of experience managing complex cancers in adults and children. Tonight, we move beyond the slogans that we are very familiar with. We're asking questions Nigerians want answers to. Why are cancer deaths still so high? What does early detection really mean in Nigeria? Who's been left behind? And what must change urgently? That Dr. Shikalu, we won't allow traffic to mess up our conversation today. So let's ground it right away. When you look at Nigeria today, what cancers are we most commonly presenting with? And more importantly, how late are most of these cases coming in?
So the most common cancers, good evening everyone, the most common cancers that we have in Nigeria, or that we see in Nigeria, include breast cancer, cervical cancer, prostate cancer, colorectal cancer, and then we also have some lymphomas amongst other cancers.
The theme,
the top 5.
Oh, those are the top 5. The theme for this year talks about united by unique. In practical times, what does people-centered cancer care look like in a country where many patients are still paying out of pocket and arriving at advanced stages?
Yeah, so most patients are arriving at advanced stages. So patient-centered care, starts with a patient presenting to a health facility and getting the right care when he or she presents there. So it's very important when we talk about cancer that there is early presentation, but unfortunately in this environment, that is rarely the case.
What do you think is responsible? What are the reasons Nigerians delay seeking care?
Sorry, please repeat the question again, please. Sorry.
No, I'm asking why Nigerians delay seeking cancer care. From your experience, what are the, let's say, top 3 reasons?
Okay, sometimes it's ignorance, sometimes it's out of care, and most times it is financial implications of cancer treatment. So they simply do not have the money to go out to seek care. And then sometimes as well, the facilities to seek the care from is, very far away from them. So when they put all of those together, some patients, even though they're diagnosed early, they just, they would rather just wait until help gets their way in terms of financial assistance in seeking care. So these are some of the factors. And then fear, of course. So some patients, they feel that cancer is, an evil arrow, so to speak, or something that doesn't require orthodox care. They would rather go the traditional way or non-orthodox way, to try to seek care for their cancer. So these are some of these things that contribute to late presentation of cancer.
The perception for many Nigerians is that cancer is a death sentence. But which cancers, if detected early, have the best survivor outcomes? And are Nigerians aware of this reality? So
cancers with the most best survival outcomes, breast cancer, prostate cancer, cervical cancer, if these cancers are detected early, usually the earlier the stage a cancer is picked, the better the outcome, because the patient should be able to achieve a cure from the treatment that would be given to the patient.
I want us to talk about screening because this is often mentioned, but uptake remains very low. Which cancer screening should Nigerians genuinely prioritize by age and gender, and why are we not doing enough of them?
So again, screening is hampered by the cost implications of doing such screenings, and it could also be hampered by ignorance. But screening is available, and for patients who subscribe to screening, they are lucky because they'll be picked early, and if they are picked early, the earlier malignancies are picked, the better the chances at a cure. So, if the screening facilities, if the patients who are aware and they subscribe to screening, when they go for screening, their cancers are picked early and they're also, treated properly and they get a cure. For those of them who do not subscribe to screening, they then have to wait till they have symptoms. And by the time patients are presenting with symptoms from their cancer, most times it's already advanced, locally advanced. And unfortunately, sometimes it's already, spread. It's metastatic disease already. So at best, they will just get treatment. And the goal of treatment will just be to optimize their quality of life as opposed to ensuring a cure. Screening is actually very important.
Absolutely, but it's also very expensive. Cancer outcomes, we understand, are deeply unequal around the world. Who do you say is most disadvantaged, and how does this show up in survival outcomes, survival rates in Nigeria? Doctor, are you still there?
Yeah, I'm saying I didn't get the question. Please repeat the question.
Oh, I'm asking the category of people you would say are most disadvantaged and how this affects survival rates in Nigeria as we know it today.
The category of people most disadvantaged and how it affects the survival rate.
Exactly. The survival outcomes in Nigeria.
Okay, survival outcome. Category of people most disadvantaged. For example, that's
We're going to get back to that conversation in the course of the program. It's important that we continue to highlight the importance of awareness, public awareness, and government engagement, especially the private sector, and the need to also present some of the symptoms or screening very early. How accessible, how affordable are the screening and diagnosis like in public hospitals? There are also concerns about pediatric cancer, which is often overlooked. What are the, for instance, biggest gaps in childhood care, and what happens when families cannot afford treatment? From diagnosis to treatment, delays we understand can be deadly. What exactly does Nigeria's cancer care lose? Why do we lose so much patients at diagnosis and with issues of affordability and follow-ups being very, very important? Radiation therapy is also critical, but still largely misunderstood because many people believe that going through all of these kind of treatments accelerate and aggravate the symptoms, and they don't see any coming back from it. It's important that we open up the space for enlightenment and that government begins to also invest in research and begin to subsidize many of these processes for those who are affected. What role does radiation play today in curing or controlling cancer? And what are the genuine fears that patients wrongly have about it? There are also people who would say there are alternative care, go through other means apart from the orthodox medicine that we are acquainted with. Are we exploring these from the scientific point of view? Are we paying attention to it? Are we also bringing some form of regulation into this space in order to be able to ensure that we get it right? Nigerians often travel abroad for cancer care, and you find out that it's only a few individuals who have the capacity, who can ensure, who can take advantage of treatments outside the country, but there's also the need to identify what the quality of overseas treatment is like and when it's necessary and when it's simply a failure of trust or information at home. There's no doubt that cancer care is expensive everywhere, but it's also devastating without safety nets. So when patients pay out of pocket in Nigeria, it's something else entirely. What must government do right now to prioritize insurance coverage to ensure that every Nigerian, has access, to ensure that our hospitals and healthcare facilities, we have the adequate manpower, we are able to decentralize cancer centers from just mainly urban areas to Nigerians also living in rural areas. Dr. Shikalu, glad to have you back. I'm looking at the 2026 focus now, and it has to do with personal stories. What has the patient experience taught you about the emotional and social toll of cancer that statistics do not usually capture? Doctor, can you hear me? Thank you for staying the course on the show, everyone. For Nigerians watching tonight, many are afraid, some are in denial, and we are trying hard to get our hands on experts who can help us explain the reality of this disease and what we need to do differently as the single most important step that we must take this year regarding cancer. My guest is an oncologist who just walked in. We are completely out of time. So what we're going to do is keep her for the news at 7 p.m. and engage her more extensively. That's our show today, everyone. Thank you so much for being a part of it. I am Nifemi Oguntoye. See you again at 7 p.m.